I'm Herbert Chavez, idol is the man of steel, and I hope to become the man of plastic. As a kid, I love superheroes because the first movie that I watched is Superman 2 of Christopher Reeve. So I dream to become this superhero someday.
Well, you've heard of people having plastic surgery to look like Kim Kardashian, Justin Bieber, and Kylie Jenner. But have you heard of somebody undergoing plastic surgery to look like Christopher Reeve's Superman? Now you have.
I was 16 when I had my first contact lenses, secondhand, so I don't know who is the owner, just my friend gave to me as my birthday present.
I'm not an ophthalmologist, but any doctor would probably tell you that using somebody else's contact lenses is a terrible idea. It's just asking for pink eye.
That is also the time that I start to use the makeup to change from Herbert Chavez to this superhero guy. As of now, I have 23 surgeries and procedures to look like Superman. I had 3 major procedures for my abs for mesolipo.
A young man like this, really anybody this young, undergoing 23 cosmetic procedures is just too much. The body isn't meant to undergo this much surgery or cosmetic treatments. Now, mesolipo is a term used for mesotherapy. Mesotherapy is the injection of a witch's brew concoction of caustic substances into the skin and the fat to help melt the fat away. There is no standard recipe for mesotherapy. It basically is just whatever a doctor wants to put together that they think might work.
But my abs last only for 6 months. What I want now is to have the permanent abs implant. If the doctor can do this procedure for other people to become good looking, why the doctor cannot make this one for me to become a superhero?
What doesn't make sense to me here is that mesotherapy is considered permanent. Those fat cells are destroyed by the mesotherapy. So for it to only last 6 months is a bit of a question. Why does it only last that long? Now, permanent ab implants are a whole other thing. There are some doctors that will place silicone implants into the rectus muscles, into the sheath where the muscles lie, to give people basically a fake six-pack.
I like to show to the people, especially the children of the Philippines, that I'm here. Superman is real.
Come here.
What I want is to give them inspiration, to give hope.
Oh, yeah, sure, thank you.
Well, I have to hand it to him. He does seem like a really nice guy who just wants to do good. But the problem is by undergoing all of these cosmetic procedures, are you then giving the wrong impression to young people that in order to look the way you want to, you should undergo cosmetic surgery and that maybe it's not that big of a deal? Well, as you know by watching my videos, cosmetic surgery is a big deal.
Hello, doctors. I'm Herbert Chavez. I'm the Philippine superhero.
Awesome. Come on in. Wow. You're cool looking, man. What'd you do here?
They put a silicone oil before.
So that's filler.
Yeah,
Filler?
sounds like filler.
Silicone oil, medical grade, is considered a permanent filler. This is not a treatment that I recommend because even though it may inject as a liquid, even though it may feel soft for a while, it can harden and the body can react to it months or even years later. Stick with hyaluronic acid fillers like Restylane or Juvederm. I do not recommend silicone injected into you.
Because in the Philippines, we can do this without any permission or any signing.
You didn't need to be a doctor.
Yeah, sometimes only friends making for you for a mesolipo or injection for a glutathione like that.
Really? Wow.
Yeah.
So I mentioned what mesotherapy is. It is injection of caustic substances to ideally melt fat in the body. And the reason why I'm against that procedure is because there's absolutely no standardization to it. There's no true testing that has been done of it to make sure that it's safe and that it works the way we want it to. So if you're having mesotherapy, especially he's saying by people who are not even necessarily doctors, you are potentially putting yourself at risk of major, major problems.
Those treatments are not accepted in this country, and they're not tested really anywhere in the world in terms of the safety, and are really not recommended.
So I agree with his assessment of mesotherapy or mesolipo, but glutathione is a bit of a different thing. Now, glutathione is actually being used quite commonly now as an IV therapy to help with the immune system, and there are a lot of people who are injecting glutathione via IV like they're having, let's say, vitamin C infusions. Well, it's also used quite often overseas as a way to lighten the skin. There is this kind of side effect that you can get of lightening the skin. I do think you're maybe seeing some of that with Herbert here. Now, although I don't do them in my office, to my knowledge, I believe it's relatively safe to undergo glutathione IV treatments. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
The problem is I got some like the black spots, like that, even at my back here.
Right. So we call that in this country mesotherapy, and it's illegal here.
Really?
Yeah, it's not FDA approved because they can cause major problems like some of the problems that you've had.
So he mentions dark spots. What could those dark spots be? Well, two things come to mind. The first thing is if you get inflammation of your skin and you have a good amount of pigment, let's say you have darker skin, you can get post-inflammatory hyperpigmentation, or PIH. And this is basically a deposit of melanin in the area of the inflammation, and that can last months or even years potentially. The other thing that could be black is if that mesotherapy actually destroyed some of these cells, created necrosis of the skin, then that can turn a bit black as well. Hopefully it's the former, PIH, not the latter, necrosis.
I was surprised that mesolipo is not approved here, because in the Philippines we can do as much as we want.
So it's true that mesolipo is not approved in the US, although there is one type of mesotherapy that is, and it's called Kybella. Kybella is deoxycholic acid, and this is a naturally occurring substance in our GI tract that basically dissolves away fat. Well, it is FDA approved for injection underneath the chin to melt away the submental fat, and we do that treatment in my office all the time.
What is it that you want?
I want permanent abs like Superman.
Do you work out? Do you exercise?
But why I need to do this? You are here.
So you're saying you want to have abs of steel?
Everything. The chest also.
Now, this is the problem with plastic surgery. People think that instead of dieting, instead of exercising, instead of taking care of yourself, I'll just go see the plastic surgeon and he'll give me abs of steel instead. It really is not the best way to go. The ideal is to do everything that you reasonably can to get yourself where you want to go. And if you need a little bit of a nudge from a little plastic surgery, if it's reasonable from somebody like myself, then we're happy to consider doing it.
Check this out.
Is that visceral?
What are all these little spots?
Because
They're the injections, right? Do me a favor, stand up. Okay.
Hey, you know what, does he need this for a minute? Here, take that off for 1 second.
Turn around for 1 second. This way. Did you have injections back here too?
Yeah.
So you had those chemicals injected all over your waist and torso.
Yeah.
So it appears that each one of those areas where they injected it created a little bit of PIH, that hyperpigmentation. And that's why it's got all of those little spots there. That also could be a sign of underlying scar tissue as well, because these substances are quite inflammatory.
It's very clear that he's had multiple injections of chemical irritants designed to dissolve the fat under his skin. He's got fibrotic areas, scars, nodules. He's kind of like the human pincushion.
Anytime you have surgery, it creates scar tissue, and typically that's under the surface. And this is different than a scar that you see on the skin. When he's undergoing these treatments of mesotherapy, he's also potentially getting scar tissue under the surface. Now, the difference between what he has had, which is creating these fibrous, fibrotic bands, and Kybella, is that Kybella is this one substance that has been found not to destroy skin, destroy muscle, or destroy even nerves and blood vessels. But mesotherapy, once again, it is kind of a witch's brew of whatever a doctor wants to put together to inject into you. And these haven't necessarily been proven not to cause damage to the skin and the other structures around that fat.
The options that we have are an implant, which we don't really do very much of in this area because the blood supply doesn't really allow it to heal that well. The other option is we do abdominal etching. We take out the fat to show your abdominal wall muscles.
Abdominal etching goes by a number of different terms. Some people call it high-def liposuction, medium-def, low-def, but the idea is basically the same. You are liposuctioning around the muscle to create the appearance of a six-pack, and you're using the fat to actually look a bit like muscle. Now, I don't perform abdominal etching. My concern with this surgery is that it may look like a six-pack now when you're young and your skin is tight, but how's it going to look 10, 20, 30 years later when that skin starts to sag? Or how are you going to look if you gain weight in that area and you turn that six-pack into a keg?
You've had so much poison injected into your abdomen and your flanks. The risks outweigh the benefits. I think this superhero needs to get in the gym.
I eat a lot of chocolate. Sound like Dean Cain.
You eat a lot of chocolate.
Yeah.
So could you actually do lipo on him? And the answer is you actually could. So I wonder if Dr. Dubrow is saying no because he thinks he's going to be at high risk of issues, or because really this is a person who ideally would get that type of body in a different way.
I'm not disappointed because maybe if they're not the right person to do this thing, somebody will do this in the future.
Just when I think it's going well, he says that. That is one of the main problems in plastic surgery, is you have doctors who are being responsible, like Dr. Dubrow, saying, don't do this, it's not right for you, and the patient says, well, then I'll go see Dr. Joe Schmo down the street and have it done. Herbert seems like such a nice guy. I really hope that he does take Dr. Dubrow's advice to heart. Well, this was an episode of Botched where the botched doctors decided not to perform surgery because it would cause more problems than it would help. But what about those operations that they do perform that create major changes? Take a peek at this playlist right up here that I created for you, where I react to multiple episodes of Botched. These are going to blow your mind. And if you've been enjoying these videos, I would ask you please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.